In this video, we'll cover OET speaking with a real-life sample. We'll look at this question, and this is what the interlocutor will have. Roleplay card number 1. This is the setting, this is the patient, and these are the tasks that the interlocutor or the person speaking and interacting with you in the exam will have. You can look at it if you would like in your preparation time, but I suggest you give it the least amount of time just so you can skim over it and understand how the patient would react to your questions. However, the main candidate card you want to look at is this one. This is where you understand your roles and what you have to say. So in this setting, you are in a local medical clinic, and by the way, the same rules that are used here apply to other OET fields such as physiotherapist, dentistry, etc. Here you are a doctor conducting a consultation for a patient diagnosed with hypertension. Remember, if you don't know much about hypertension, you don't have to worry because general knowledge is not needed, technical knowledge is not needed. As long as you can express your ideas clearly, you're good to go. Now, these are the tasks you have to address, and these are fairly long, a little bit longer than many tests, but this is a good opportunity for you to practice. Once again, you can pause the video, look at your screen here. These are your tasks, and you can see if you can perform and record yourself, then play this video, and I'll give you some really important tips, tricks, and suggestions. Try it again, record yourself again, and see the difference. That's the best way to improve. Now, the first thing you got to do is it says, welcome the patient and introduce yourself as a doctor specializing in hypertension management. So the first thing you want to always do is do the greeting, which is short. Hi, how are you? Simple. Get that out of the way. I'm good. Perfect. Let's move on now. The next thing you're going to say is the name. You're going to confirm their name and you're going to tell them who you are. So my name is Dr. Sean, and I understand you're Mr. Alexander, correct? So you verify that. They're going to say yes. Usually there's no opposition here. There's no rebuttals. It's just validation, warm up, and now you have to validate the patient's concerns and acknowledge the impact of hypertension on their health. So throughout this video, I'm going to be using some special words and phrases that you want to pay attention to. You can take notes as well. So how I'm going to do this is I'm going to say, I understand that you're here concerned about your hypertension. Is that correct? That's all. So you always have to validate with questions like, is that correct? Do I understand that correctly? Is that what was presented to me as the right information, or is there something you would like to add, etc. Now, the next thing asks you something that will confuse a lot of you because it requires a little bit of technical knowledge. It says provide detailed information about hypertension, including causes, risk, potential complications. Whenever you have these words, detailed, it means you got to talk long. Okay, so make sure to look at those specific words. Now you have the next word, emphasize, and here it means you really got to make this sound important. Emphasize the importance of blood pressure control and the benefits of a healthy lifestyle. So when you do this, you want to make sure you raise your volume a little bit and really emphasize these points. Coming back to the technical knowledge, you can make stuff up, you can make up prescriptions, and you can do all those things. You are not marked on any of this at all. However, if you have technical knowledge, feel free to show it off and use whatever you know, or you can make it up. So I'm going to say the person after the person has validated that, yeah, they're pretty concerned about hypertension. My next thing before providing detailed feedback would be responding to that tension instead of just moving on. And that's one big mistake that students make. So let me do a follow-up on that thing that the patient in this case would have said. I would say, understandably, this is a cause for concern. However, let's analyze the causes, symptoms, and what we can do to help and what you can implement in your lifestyle as well. Now here, just jump into the information. You don't always have to keep saying, is that okay? Too much of that is a problem. Too little of that is a problem too. So I'm going to keep going, assuming the patient, which is the interlocutor, is nodding and in approval. I'm going to say hypertension can be caused by many factors. It's usually related to genetics, but it could also happen due to lifestyle changes, stress problems, and again, there's a list of complications. In this case, there are some risk factors that you would need to consider. I'm not trying to scare you. However, there could be a risk of serious lung disease or even a stroke if there is a consistent pattern of hypertension. As you can understand, it means high blood pressure, and that could also lead to complications such as early death, reduced life expectancy, or reduced quality of life, as well as other potential diseases. However, instead of stressing about these issues, it is highly important that we maintain your blood pressure by adapting to a healthier lifestyle, which means healthy eating, good sleep, having reduced stress, and most importantly, having peace of mind, because your mind would control your entire health. Are you understanding what I'm trying to relate to you right now? Okay, the person would respond now. So you can see it's detailed. Okay, and every time when we're starting a new sentence, there's some sort of connector. It can also lead to. What's important to understand is, however, don't worry, because we have these solutions. So there's the word however. So make sure each sentence starts with a connector or a flow, and then you're going to other parts from there. Now, we emphasized this. Our volume was high, but when we were doing the detail, we were descriptive. So now the person answers, and yeah, they're pretty stressed, and yeah, okay, doctor, what else can I do? What are your recommendations for lifestyle modifications? And that's what you would discuss here: diet, exercise, sodium. So when you are talking, you can keep looking at your notes, look, and then go up. All points are here, you don't even have to think. And then when they ask you what these lifestyle modifications would be, you would say something like, absolutely. It'll be my pleasure to make you more aware of these approaches. So using words like absolutely, definitely, certainly. These words have lees in them, adverbs. So another layer or a range of vocab is used, which the examiners will appreciate. Absolutely, let's jump right into it. The first thing is dietary changes. You have to cut on your carbohydrates, try to adapt more protein-rich diets, but more importantly, try to keep it balanced. Furthermore, regular exercise is highly important. I understand you have a busy schedule. However, walking even 20 minutes a day would do wonders for your health. Furthermore, you have to manage your sleep better, as well as reduce stress levels in your daily lifestyle and routine. Lastly, I'm going to ask you to highly reduce your sodium intake by approximately 60 to 70% of what you're consuming right now. Do you think you could do all of this in the next 2 to 3 months if we were to make a practical plan for you? Here, you have a lot of realistic scenarios. You're giving numbers, next 6 to 7 months, sodium 60 to 70%. And I know you're a busy person, but try to sleep better, try to have exercise. So we are making it realistic. It sounds like I know this patient, or we have talked a little bit, and the interlocutor will most likely give you these points talking about their lifestyle. They might say something like, hey, I am just too busy. I don't know if I can manage exercise. So that is something you can use to add to your answer. And then again, giving specific timelines or specific details makes it sound more realistic. Throughout this speaking also, you will notice my tone. It's medium paced, and there's emphasis where there needs to be. There is also pause between sentences and points. So make sure to use that. Take deep breaths in between, and it keeps you motivated and not nervous. Now you want to address the patient's questions about medication management. So they're probably going to ask you about how many doses should I take and so on, side effects. Now you have to address the patient's questions, which means you don't have to just start by listing the medications and dosages. The patient will say, well, I'm concerned about how much should I take and what could be the side effects. So now you have to follow that up with an answer. So you would say something like, of course, having or being aware of the side effects of your medications is highly important. I'm here to help you with that. The first thing you want to do is, and we're going to pause here before it's too much information. For now, this is what you need to work on. You can review the video again, practice using a recorder, see how drastic your changes initially versus after listening to this lesson. In the next video, which is going to be uploaded in just a few days, we will discuss how to cover the remaining questions, sample answers, and how to do the ending. So please subscribe if you haven't already so you can be notified of that video. We'll talk very soon.